Okay, we're doing part 4 of the book here. I Will Give You Your Health Back by Dr. Day. So the first couple quotes from the Bible, she quotes, your body is the temple of God's Spirit. He who defiles God's temple, him will God destroy. 1 Corinthians chapter 3, verses 16 and 17. Okay, whatsoever you eat or drink, or whatsoever you do, do all to the glory of God. 1 Corinthians chapter 10, verse 31. So again, it's the idea of, your body was given to you by God. God designed it. God told you how to handle it. Basically, what we're supposed to do is live like Adam and Eve. Okay? What did humans do? Our ancestors thousands of years ago, they walked around in extended family groups, outdoors, in the sunshine, looking for food. Okay, helping each other, eating whole plant foods that grow outside. We got flat teeth, the jaw can go side to side, it's to grind plant foods. Imagine yourself walking outdoors, and you're walking down a trail in the forest and you see a dead deer carcass on the ground. There's a bunch of flies buzzing over it. Do you want to get down on your knees and take a bite out of it? It's kind of disgusting, okay? On the other hand, if I put a bowl of fruit on the table, you would salivate, okay? That's what you're made for. Okay, that's why we got color vision. We can see when a fruit is ripe. That's why we don't make vitamin C, because there's lots of it in fruits and vegetables. Okay, so anyways, she's going to talk about exercise now. She says, exercise does so many wonderful things for you. Exercise makes you thinner, makes you better looking, makes you smarter, helps you sleep better, better immune function, you live longer, lowers your blood cholesterol, less hypertension, diabetes, obesity, coronary artery disease. It prevents osteoporosis, and it's free. So why wouldn't you exercise? Everybody should exercise. You got to figure out how much you can handle, but it's good to exercise. What I found exercise I like doing, I like to read on a treadmill because I can concentrate really good on a treadmill because we're made to concentrate while we're walking. I mean, when you walk, you got to be paying attention. You got to avoid obstacles, plan a destination, remember where you came from, and be alert to any change as you're going down the path. So the point is, it makes you alert, and that makes it easier to read a book. I find I can read relatively complex books 2 hours straight while I'm on a treadmill. So I like doing it. I got a little tiny treadmill. Okay, next thing she talks about. Poor diet, stress, and caffeine all can cause dehydration. So now she's talking about hydration. So if you're eating a lot of animal foods, they don't have much water. And when you eat plant foods, they naturally have a lot of water in them. Caffeine dehydrates you, so does stress. They have stress and caffeine and sleep deprivation are all kind of the same thing. Elevated cortisol and catecholamines, adrenaline, noradrenaline. They cause you to void, to urinate out of your body your magnesium, which you don't want to do. So you got to be careful about that. That's why you want to eat a lot of plants. Magnesium is right in the center of chlorophyll. So by eating plants, you get magnesium. So all these things are bad. Coffee, tea, chocolate, soda pop, energy drinks. Okay. She's telling you the truth as best she can. Okay, notice all the BS artists on the internet, the high-fat phonies and the bro science, all these other people saying, oh, coffee's good for you. Oh, BS. Caffeine is not good for you. Taking stimulants is not good for you. Caffeine is a stimulant. Cerebral vasoconstriction, you don't want that. And it's also an excitotoxin, increasing glutamate transmission across synapses. Okay, all body parts work better with adequate hydration. You don't have to overdo it, but you should be reasonably well hydrated. I can tell you the marathon runners up until 1970, they didn't even drink any water at all during the whole 26 miles. I wrestled in college. Every practice we'd sweat off 5 or 10 pounds and felt just fine, So excessive dehydration, that's a problem. But a little bit of volatility, 5 or 10 pounds there, it's not that big a deal. Okay, what else? She says when you're dehydrated, that increases your risk of blood clotting. And I think that's interesting because I think a lot of people are walking around doing a lot of things that make their blood predisposed to clot. If you don't eat your dietary fiber, you're predisposed to leaky gut. That lets bacterial endotoxins into your blood. That can cause, amyloid clotting. So that increases your risk of clotting. If you have poor teeth, poor dentition, that increases your risk of leaky gingiva, and you can get bacteria from your mouth getting into your blood. That increases your risk of LTA from gram-positives, LPS from gram-negatives, lipopolysaccharide, lipoglycolic acid. That can cause amyloid clotting in your blood. If you're dehydrated, if you're drinking caffeine, sleep-deprived, stressed out, that can all get you to void more, become dehydrated. If you're iron overload, you'll get excess free iron in your blood. That can cause, the Fenton reaction, and that can also cause amyloid clotting. Okay, high sodium diet, the high sodium, dietary sodium will cause activation of platelets. That increases your risk of clotting. If you're taking excessive amounts of calcium supplements for osteoporosis, like more than 1,400 milligrams a day. If you take it in a bolus, you're bolusing your blood with a blood clotting factor. That's why women who took that much calcium supplements had 2.6 times increased risk of death from heart attacks, making themselves transiently prothrombotic. Not a smart thing to do. Okay, if you're sedentary, you don't move around, that also increases the risk of clotting. Okay, so what types of water filters? Carbon filter removes benzene, herbicides, chlorine, volatile organic chemicals, VOCs, trihalomethanes, also estrogenics. Reverse osmosis also removes fluoride. It also, I think I recall it removing aluminum pretty well. I had to double check that, but that's what I recall. I'm not sure of that. Most contaminants except some viruses and some arsenic. The cleanest drinking water, she says, comes from a combination of carbon filtration followed by steam distillation. She says distilled water's pH is 7. I'm not so sure about that. I can recall doing all these experiments with water filtration. I think the more I filtered it, the more acidic it got. I recall it being more acidic than that, so I'd have to double check that, but that was my recollection. She says, me personally, I worry about drinking distilled water because hypoosmolarity can result from that, especially, the bigger the amount, the smaller the person. So I know Dr. Goldhamer at True North's done a lot of great things, and I'm pretty sure I've read that he is a proponent of distilled water. But again, I don't know how they drink it. If they drink it in several small amounts, I would be afraid to drink a big gulp of, big giant cup or couple cups of distilled water. That it would make me hypoosmolar. So I'm not convinced of that one yet. But I do know there's been other pretty prominent people. John Yeomamis, sort of the famous guy who wrote a book on fluoride, recommended distilled water, as well as some others. Okay, Dr. Day says acidosis in blood is caused by eating animal foods. We know that. The animal proteins got more methionine, partly metabolized into sulfuric acid, causing a low-grade metabolic acidosis. She points out that excessive simple sugars can also cause a low-grade metabolic acidosis. So that's 2 strikes against you. But then if you're eating a lot of dietary sodium, the sodium chloride causes a bolus of chloride coming into the blood. That'll displace the bicarbonate, and the bicarbonate is the pH buffer. So that'll also cause a low-grade metabolic acidosis. If you're drinking a lot of alcohol, that can cause a lactic acidosis. If you're eating a paleo keto carnivore diet, you can get acidosis, metabolic acidosis from the ketosis of a ketogenic diet. So you can see this is bad. Why do I say this is bad? Think about it. What predisposes to cancer? Hypoxia. What do clots cause? Hypoxia. What suppresses the immune system? Acidosis. Tons of people on this ketogenic diet, they're acidotic from the ketogenic diet. They're acidotic from the high dietary sodium to try to make the meat taste better. They're acidotic from eating all the animal protein, and they're probably avoiding simple sugars. I'll give them credit for that. not from much else though. It's a totally stupid diet. If they're drinking alcohol, that could make it worse. Okay, then she talks about sunlight. She says sunlight's good. It's a wonderful thing. Increases your vitamin D, vasodilation from nitric oxide precursors to prevent hypertension, improves mitochondrial function. What I think that's all about is I think it's causing a phase change in the fluid, the water within the mitochondrial matrix, especially around ATP synthase. I think it's changing from phase 4 to phase 3, so to speak. Well, what I mean by that is, at rest, I think the water is largely in a gel form, like Gerald Pollack's 4th phase. And then when the calcium comes in to the cytoplasm or to the mitochondria, I think it's causing it to fluidize. And that's facilitating more rapid spinning of the ATP synthase to make ATP. That's my impression from the preliminary papers I've read. Okay, it improves immune function, the sunlight, resistance to infection. You take TB patients and you put them on the sunny side of the hospital, they get better, faster. Other patients, for other reasons, you put them on the sunny side of the hospital, the window open, they get some fresh air, they get better, faster. And that's why they used to take patients out in the sun. That's why a lot of these healing sanitariums have good sunlight, warm climate. Better tissue oxygenation, better mitochondrial function. All these things seem like reasons why sunlight would help lower the risk of cancer and make the body more resistant to infection. So it improves immune function. That's a big deal. It improves blood pressure. It lowers blood sugars in diabetics. But if you have nitric oxide effect where you open up the capillaries in the muscles, it's going to have more access to getting into all the muscles, and so that's going to cause less insulin resistance. Things that inhibit nitric oxide, like uric acid and the dietary sodium, they'll cause increased insulin resistance. If you can't open the muscle capillaries, then the glucose can't get in there, the insulin can't get in there to deliver the glucose to the muscle. Okay. In the old days, when people were in the sun a lot, there was hardly any skin cancer. She points that out. And she says nowadays people get much less sunshine, but they got a lot more skin cancer. And she says melanoma is not caused by exposure to the sun. Okay, that's it for part 4 of Dr. Day's book. Hope you're finding this helpful. I still got a couple more parts.